Extension Beef Team recently hosted the 2019 Ohio Beef Cattle School webinar. Dr. Justin Kieffer, a clinical veterinarian in professional practice, also an assistant professor in the OSU Department of Animal Science, was one of the featured speakers. Dr. Kieffer is going to discuss managing calf health born into stressful situations such as weak calves, importance of the amount of colostrum intake, colostrum replacers or supplements, and suggested newborn treatments and vaccinations. We'll turn the program over to Dr. Kieffer.
So I want to thank John for inviting me to come speak on for the final presentation tonight on calf health management from the time they hit the ground for the first few weeks of life, which is pretty pertinent. A lot of you are probably starting to calve right now or thinking about it, so it's a good time of year to remind everyone how to take care of these calves from the time they're about ready to hit the ground until we're thinking about vaccinating them. If you have questions, well, I'll shoot those to John while I'm talking, and we'll try to answer those at the end, and I'll also give you my email address so you can actually email me questions. So with that, we'll just keep rolling. So I want to start at the beginning, because if we're going to talk about calf health, we need to talk about parturition, or the time of calving. So we really need to pay attention to our cows, and especially our heifers during the calving process, because if we are going to intervene, we need to pay attention. I know a lot of you bring your cows up and your heifers up and monitor them in calving. That's really important. And we need to pay attention during the entire process. We need to let them do their job, but also be available to intervene if we need to. I'm not one to rush in and pull a calf if I don't have to. I like to give that cow and heifer time to work. That's their job. But if I don't see anything progressing in a couple of hours of active labor, so what is active labor? You see this picture here on the ground, this heifer laying on the ground, she's actively pushing, we've got a sack out, tail's up, and she's straining. That's active labor. That's not just walking around with a bagged up udder and the swollen vulva. I want to see active pushing. That's what we call active labor. So if I don't see any progress in a couple hours of her pushing, I don't see the calf coming out, then maybe it's time to think about checking that cow, and we'll talk about that too. When a cow starts to calve and things don't go right, it's not like the calf is going to die immediately. Unlike other species and horses especially, foals can die pretty quickly if things go wrong during the foaling process. And that's not true for calves. They can live 8 to 10 hours once active labor starts. Past that range, they tend to die or be not very viable at that point. So they can take a little bit of abuse during that calving process. Not that we want that, but they can take it. So if we decide to intervene, to check that cow out, to see if we need to pull it, we need to catch the cow. I do not personally like putting cows into squeeze chutes. It's not very easy to pull a calf in a squeeze chute. There's very little room for me as a veterinarian or you as a producer to pull the calf out. I like to put the cow in a head catch where she's loose, where she can swing around, or we can halter the cow and tie her to a barn post just so she can't move too much on us. That gives that cow room to lay down, maybe even on her side as we're pulling, because a lot of cows will do that once we place pressure on their pelvis with the calf. So once again, I don't recommend using a squeeze chute. What's the process if I do want to check the cow? I'm going to wear clean, fresh OB sleeves. I'm going to take a warm, soapy bucket of water and clean her back end off, clean all any manure and fluids off the back end before we put our hands in, and use plenty of lubrication to feel around and see where that calf is positioned. Take a little bit of time, be careful. Feel around, determine if the calf can be pulled or not. A lot of times when the calf is coming normally, which means the head and the front legs, if I pull the head up and the front legs cheat back, or if I pull the head and the front legs come back, that kind of tells me that that calf is sized way too big for that pelvis, and the calf probably needs to come out via C-section. That's kind of how I determine calvings, or what needs to happen is that first couple pulls. If we're not getting any progress, maybe we need to change our strategy on getting the calf out. So talk about presentations real quick. I'm not going to go too far into this, but what's the normal presentation? So I've got a picture on the left here of a calf coming normally. We've got the head up in the pelvic canal and the front feet coming straight at us. One of the questions I get a lot from producers and clients when I was in private practice is, how can I tell which feet are which? So look at a calf as it's walking around. Which way do its feet bend? Its front feet bend this way, its back feet bend a different direction. Okay, sometimes it can be a bit confusing to me at first when I stick my arm in a cow. Is it an elbow or a hock? And then have to cheat back and feel around the front legs or the distal part of the legs to see which way these joints break. backwards or forwards, and then I know I've got a front leg or a back leg. On the right-hand side, you've got a bunch of these abnormal positions, which, as me as a veterinarian, are no fun to try and pull. I have very few favorites here. One of the worst ones I ever have are head backs. So you have front feet coming and the head pinched back. Those are very difficult to correct. Usually with these other presentations, we got a foot and one feet in the head, one front foot in the head. Those are pretty easy to fix, or head down, we can pick up. But these other ones, transverse or breech, are very, very difficult for me to correct. And those usually require you as a producer to intervene, or usually the veterinarian to help with. So don't be afraid to make a phone call if you don't know which way the calf is coming. You can't make heads or tails of how it has to come out. So once we get the calf coming out, we get it in the right direction. If we can't pull it physically out by hand, or the cow doesn't push it out onto us after we've corrected the position of the calf, we need to place the chains properly, and I have a close-up picture coming up next to that. We're going to put those chains on properly, use gentle traction by hand with chains and chain handles, or you can see it with a calf jack device here, placed on the cow's rump, and the chains attached to the feet, and we just ratchet that calf out. Never ever use motorized equipment. So there are still some people that will use a skid steer or even a truck or a tractor to pull a calf. Never do that. You can cause lots and lots of damage. Always use traction by hand or via a come along or a calf jack. If you're pulling a calf and you can't make any progress in about an hour of trying to pull that calf out, you need to call your veterinarian so that you can make a decision on what to do with that cow. Do we try a C-section? Do we try a pitotomy? Is it time to call it quits? Is the cow looking tough? Do we need to euthanize? But don't spend 4 or 5 hours struggling when you're not making any progress. Here's a really great picture of how chains are properly placed to avoid breaking the leg on a calf. And I've seen people break legs before if chains are not placed properly. So here we've got the front feet of the calf. Here's the tongue sticking out, so they're coming in the right direction. We're going in the right way. The first thing we're going to do is place a loop in the chain and loop that chain above the fetlock. So this is the fetlock joint here. Above that, that's the cannon bone. Then we're going to do that with the other end of the chain. Then we're going to take our chain and make a loop half hitch and go right across these two bones on the feet. And we're going to do the same on the other side. So we get 2 points biting into the leg here, and that's almost impossible to break the calf's leg unless you pull in an extreme hard manner, which I've never seen. But if you were just to loop the chain just one limb above the fetlock here and then pull, we have a lot greater tendency to snap that long cannon bone rather than doing these two loop technique over the fetlock and part of the toe. So that's the way I recommend pulling calves if you're going to apply chains. So let's say we go through the scenario. We've got a tough calving, we had a head back, and we got the head up and pulled the calf out for a long pull. So what's the next step? And these are typically calves that are tough to deal with. They've struggled in utero. They may not have the highest oxygen level present in their blood due to that struggling. They may be physically exhausted. They may have what's called a respiratory acidosis, and I'll explain that in the next couple of slides. But what do I do and what do I recommend producers do after we get the calf out? Is to get the calf out, make sure we get the fluids and membranes clear the calf's nose as soon as it clears the vulva, because once that calf's nose hits the outside air, they're going to try to breathe, and that's what we want them to do, so we need to make sure the airway's clean. Once we get the calf on the ground, I like to put some straw in the nose to stimulate that strong respiratory reflex. There's lots of calf rescue devices for sale out there, and some of them are really good to force ventilate those cows, and also you can use some of those for suction to inhale fluids out. In actuality, a lot of the fluids that you see coming out of the nose of a calf are not coming from the lungs. They're coming from their stomach or their abomasum. They're regurgitated that they've swallowed it during the calving process. So don't think that those fluids are necessarily lung fluids. They're coming from their gut, and we don't want those to blow back into their lungs, so they need to come out. Another way I've resuscitated weak calves as they come out that are looking really tough to me, that need a strong wake up or shake me type event. Pour ice cold water in the calf's ear. Just cup the calf's ear up in your hand and pour ice cold water in there. That results in a strong respiratory gas. If you've ever jumped into ice water or an icy pond as a kid, just for the heck of it, it'll take your breath away. It's very shocking. It's the same for the calf, although we don't really want to soak the calf in ice water. But if you pour ice water in your ear, it really does provoke a strong response. You'll get a strong breath in and a head shake and a mean look from the calf, and that's what I want. And the last thing I do is we put the calf in the recovery position. So when we take a calf out and we need to get the fluids out of it, one of the things we don't want to do is force those fluids out by, number one, swinging this calf as this producer is doing down here to try to blow all the fluids out of the nose, or hang the calf by a gate. Some of you Older producers may have done that by locking the calf's legs up in the air against the gate as its nose is touching the ground in hopes those fluids will drain out. When you hang a calf upside down like that, or if you're moving a calf around in a circular direction, like this producer is doing, all that force, all the intestines, which is the main volume of the abdomen, are pushing on the diaphragm, and that calf can't expand its lungs backwards at all. And the same is true when they're laying upside down. All that pressure pushes on their lungs, and we absolutely do not want to do that. So never hang or swing a calf to get the fluids out. Use a calf rescue device or suction device to pull those fluids out. Absolutely. What's the recovery position? This has taken hold the past several years from some really good veterinarians out there, and I really strongly advocate putting a calf in a recovery position after we pull them. We want to establish proper ventilation. The best way to do that is to set them up in a body position where their lungs can expand very easily. That's not hanging from a gate, definitely, or laying on their sides or on their back. That's on their chest, on their sternum, like this calf is doing with their front legs pushed out in front of them. You can see in this position here, this calf's got his head on the ground, elbows and front legs pointing forward, and rear legs are pointing forward too, and his chest on the ground. Here's a top view of a different calf. This is the recovery position. This allows the lungs and the diaphragm to expand a lot easier than if the calf was laying on its side or being hung upside down. I strongly recommend you put calves that you pulled in that position after you get them out. If we pull a calf out with a bunch of yellow stuff, if you've ever seen that before, that's called the meconium, or the first species. To me, that's an indicator of stress during the calving. That I typically see it a lot in breech calvings, or calves where their heads are back or they're transverse, and we really struggle to get that calf out. So that's an indicator that we're going to probably have a slow calf when we get it on the ground. We need to give it some extra attention and TLC when it comes out to make sure it eats, gets colostrum. If we need to do any medical interventions, it's really important to watch for that. So what are the effects of dystocia on the calf, speaking of meconium? So prolonged calving, and they're in that uterus and mom's squeezing on them or trying to slide out, that can create a lot of changes in the calf that lead to that weakness and that inability to stand and nurse that we really get concerned about after they're born. So what exactly happens that causes these problems? So when the calf is in utero, it's getting oxygen from mom through her placenta, through the umbilical cord, okay? Calves, as they go through the calving process, CO2 will continue to build up in their bloodstream as they are starting to lose that blood flow from the placenta and beginning to think about breathing through their lungs. So the longer that process goes, the more that carbon dioxide builds up. Low oxygen tension in their blood also becomes an issue, and we see that with sometimes what are called dummy calves that come out backwards. They didn't have a chance to breathe very well. That may have inhaled some fluids. So those two things can play a pretty good role. CO2, carbon dioxide, is a weak acid. It can create what's called a respiratory acidosis, or a low blood pH. If you've seen calves that have had diarrhea for several days and they're weak, down, and can't get up, don't have a suckle reflex, that is a metabolic acidosis. It's the same condition, only it's due to diarrhea and not respiratory problems. But the song remains the same. The low blood pH causes this really profound muscle weakness and no ability to suck. If you were to stick your finger in that calf's mouth, they would have no ability or desire to suck. So how do we fix that? We can do this pretty quickly with intravenous sodium bicarbonate. The typical dose is 1 to 2 cc's of 8.4% injectable sodium bicarbonate per pound of calf, depending on how severe their acidosis is, and your vet can teach you how to do that. And that can help stimulate those weak calves that have spent a long time in the birthing canal and we've struggled to get them going and fix that acidosis and get them breathing. If you have access to supplemental oxygen, some people might have an oxygen tank. That's really, really helpful. Or using a calf rescue device where we can suction out that fluids and forcefully ventilate that calf, that's very, very beneficial. So what are the next steps? After we get the calf out and dried off, got them in the recovery position, calf's getting up and thinking about drinking mom. Once the calf is with mom, I really like the cow to clean the calf off for a number of reasons. It helps with the bonding process, and I'm sure a lot of you producers realize that. But also, this helps the cow release her oxytocin. As that cow is cleaning the calf, her brain is releasing oxytocin, which helps with milk letdown. It also helps with smooth muscle relaxation in her uterus. So that's going to help her drop that placenta and squeeze that placenta out of her uterus, and that's what we want to happen in a pretty rapid manner. What do we look for, or what do I look for in calves in nursing? Ideally, I want them to be up in 2 hours and nursing colostrum. That's not always the case. depending on the cow and the calf and the weather and the calving scenario. But I really like to see them up and get a belly full of milk within that 2 hours. You need to pay attention to the dam, especially heifers, first calf heifers, to make sure they're allowing the calf to feed. You may have to pen them up together to encourage them to eat. I've even known some producers even sedate a heifer that won't tolerate her calf to get her to accept it in extreme scenarios. Calves really need to be clean and dry. They don't have a lot of energy reserves. They don't have a lot of internal body fat yet. So if they get behind the 8 ball in terms of energy, if they don't get that first colostrum especially, or later feedings right after that, they can get really cold and weak really rapidly, especially in a winter like this year. What else do I recommend treating these calves with? If you're in a scenario where you've dealt with a lot of umbilical infections in calves, I like dipping the navel with 7% iodine tincture. That is a specific type of iodine with alcohol in it. That's both a disinfectant and a drying agent. You should get that through your veterinarian. It actually has a hazmat fee when you have to buy it, so it's a special type of iodine. But I really, really recommend it. I don't think the weaker iodine solutions or some of the other products on the market that claim to help with umbilical infections really help clean up the bacteria, as well as 7% iodine tincture on that navel. So colostrum, you may know, and some of you may not know, that colostrum, calves are not born with any immune globulins or the protective agents that help latch on to the bacteria and viruses that cause infections in calves and help their immune system eliminate those. They're going to get all those immune globulins from the colostrum from mom. Colostrum is the first milk. It's super concentrated by the time the calf gets out, and it slowly dilutes over the few days after calving. Calves only have a small window to ingest these molecules, about 24 hours from day 0 to the first day before that window completely closes. So how does that happen? Those immune globulins are drunk by the calf and go through down into the gut, and they cross the gut lining in what are called M cells. And those cells slowly close at a rate, and you can see this graph here up at the top of the screen. So this is 0 hours at birth, and then we've got 12, 18, 24 hours after birth. And this is percent immune globulin absorption on this side of the graph. And so we can see that it rapidly declines, at almost 12 hours, we're more than half gone in terms of the amount of colostrum they can absorb. At 24 hours, they can absorb really 0 colostrum. If you were to have a calf that was born and that didn't get colostrum after 24 hours, let's say it's a really valuable calf and you want to save it, the only way to get immune globulins into that calf is a plasma transfer or blood transfer from an adult cow, which your veterinarian can do. And there might be some, I know there are products for foals out there, there might be some for calves do, but it can be done through a blood transfer from an adult cow in an emergency situation. But once that 24 hours is gone by, they're not going to absorb anything. So on this 4th point down here, like I said, the calf's ability to absorb these molecules, it really peaks at about 4 hours after birth, and then it rapidly declines after that. And like I said, after 12 hours, more than half of their ability to absorb it is gone. Ideally, I like to shoot for about 6 hours of age by that time by absorbing colostrum. And a lot of beef calves are usually between 4 and 5 hours on the natural basis if you just watch them. In addition to the immune globulins, colostrum is a really high energy feed. They absolutely need to stay warm and grow. It's not just the carbohydrate, it's the fat that's present in there that provides them with a lot of energy. There's also lots of other molecules that we're really starting to begin to understand that affect the calf. There are some maternal white blood cells that we think are active in the calf that were active in mom that are transferred in the colostrum that actually help clean up some infections and prevent infections in the calf before they die off. And there's also some other molecules like relaxin that help the calf make its first manure. So there's lots of things that we're learning, not just the immune globulins that make colostrum so important for those calves to get. So there's a couple different types of products out there in terms of commercial colostrum supplements or replacers, and those two are not equal. So if we have a calf that's born and the cow dies, if you want the calf nurse, if you can't get near, or the colostrum, if she doesn't have any milk at all, then we need to replace the colostrum from another cow. Let's say we've got another nurse cow that we can take colostrum from, or from a neighboring dairy. That's ideal. They have frozen colostrum, which they usually do in their freezer. It'd be great to grab a couple quarts of that and feed it to the cow. Commercial colostrum replacers have gotten way better in the last several years in terms of quality, and they're effective if you use the right amount. Colostrum supplements, quote unquote, are not really meant to replace colostrum entirely. They're used in the case where we know the calf has got some colostrum, but we're not exactly sure how much they got and we want to boost the amount. So colostrum supplements and replacers are judged by how much IgG or immune globulin is present in the powder. So replacers typically have around 100 grams or more of IgG in their powder packages. Supplements typically have 40 to 75 grams of IgG and usually a lot less fat. So how should I use these colostrum replacers? So we want to target the calf to absorb at least 100 grams of IgG. We know that is a typical protective dose of IgG for the calf that will last a few months until their immune system starts to take hold. But remember, everything that we put into that calf, just like an adult cow or a steer calf, everything we feed into isn't always absorbed. So not all IgG that we feed to that calf via that colostrum replacer gets into the gut, into the bloodstream. So typically, to meet that goal of 100 grams, I'm going to feed 150 to 200 grams of IgG. So that could mean 2 bags of 100 grams apiece in each bag fed to that calf right away. When you're feeding these colostrum replacers, make sure to heat it and follow the directions on the label. Feed it at around the temperature it comes out of mom, which is about 100 degrees. If that fat is colder, it's not absorbed very well, and those immune globulins aren't absorbed very well either. So heat it up to the temperature of around 100 to 102 degrees Fahrenheit. Chilled calves. So if you get a calf that's born, let's say last week in the sub-zero wind chill, like I said, calves have really little energy reserve. So if they become wet and chilled, they lose body heat really, really fast, and they cannot stay warm. Calves that are cold to the touch, the calf that we touch the nose and the tail and the legs that feel really icy cold, they need immediate warmth. Warm them up by drying them off. Bring them inside your barn, your shop, your laundry room in your house, somewhere to get them warm. I got a picture here of a really cool warming box that a producer made out of an old plastic tank, probably had some farm chemicals in them. I think a lot of you could find these on your operation that you probably pitch or put other things in. Makes a great little warming box if you put some straw on the bottom and you hang a heat lamp at the top of it. It can actually get really hot in there. And that's a great way to warm a calf up. There are also some commercial warming boxes you can buy, but I think this is a pretty cheap and effective alternative for that. Bottle feeding. If the calf won't eat, you need to tube feed the calf. Anyone can teach you how to do that. It's a great way to warm them up quickly and increase their energy is to get the belly full of milk into them. If we have a calf in a scenario that's scouring, regardless of what the cause is, and most of the cause for calf scours early on are viral or parasitic. Occasionally we'll see some E. coli diarrheas, but for the most part, they're not bacterial in origin. But regardless of what's causing the diarrhea in that calf, fluid replacement is key by far and away. You can see the picture here, and this is not a beef calf, this is a Jersey calf, but this is the same scenario. The calf that has diarrhea, the first thing I'm going to do is replace fluids. Fluids, and then some more fluids, and probably some more fluids after that. I also like to feed an oral electrolyte separate from milk. So if the calf is nursing but still has diarrhea, I'm going to feed a bottle of electrolytes later in the day or a different time of day away from the milk feeding to help boost the electrolyte loss. In general, calves that are still standing will respond to oral fluid therapy, and they'll absorb those electrolytes and those nutrients pretty easily. If the calf is down, can't get up, is weak, cold around the edges, and does not have a suckle reflex, we need to do IV fluid therapy. That's typically the scenario where I start reaching for IV fluids. One thing is key if we have a scouring calf, especially these newborns, never stop feeding milk, because the immune system runs on glucose. If we stop feeding the calf and we starve it, that calf will die. We know this. So no matter what we're doing, we never stop feeding milk. We make sure they're either nursing off mom or we're supplementing milk. So newborn calf processing. If you have problems with infected navels and navel dip, use that 7% tincture of iodine. Now's the time to place your tags, your breed tattoos in your ears if you're going to do that right away. I recommend a vitamin E and selenium shot in this part of the country. Some areas may not need that, but I still think that's pretty beneficial. If you have bulls out there that you have no plans to keep as prospective herd bulls, or you're not selling seed stock, I think it's a really good time to think about castrating them. If you got the calf on the ground in front of mom and you're placing the tag and you're doing other things to the calf, why not place a band on those testicles? The calf will never know they had them. I don't really see the need for them to keep those testicles and get bigger and get larger. And then at some point have a really stressful castration event, we can remove them at birth. So I really recommend that. If you don't need to keep the bulls around, why not castrate at birth? Newborn processing in terms of vaccines. I really avoid these injectable vaccines, both modified live and killed, in calves less than 4 months of age for a couple reasons. Number one, circulating maternal antibodies, that IgG that mom has, that she's concentrated in her colostrum, that we're going to deliver to the calf, Those are circulating in the calf. And if you put an injectable vaccine, like one of the two up top here, into that calf, into the muscle of that calf, those antibodies she has are going to interrupt the absorption and processing of the antigens, and they actually won't respond to the vaccine. So there's maternal antibody interference with these injectable vaccines. Another thing, modified live vaccines, like the two up here, Express and Bovishield, they contain bovine virus diarrhea virus. Bovine virus diarrhea virus, BVD, causes immune suppression. And even the vaccine in that strain of that BVD, even though it's been neutered somewhat by the modification process, it's still alive, and it can still cause immune suppression. It's absolutely not what I want to do to a calf that's a couple months of age. So I really hold off on using these modified lives, especially until they're at least 4 months of age. So I really want to wait to give any of these kind of injectable vaccines, and yes, even the kill vaccines, until they're about 4 months of age when those maternal antibodies have waned off out of their bloodstream. What I do recommend vaccine-wise, I strongly recommend intranasal vaccines, such as Enforce 3. I'm not trying to act as an advertisement for that company, but we use a lot of it in our own cows here at OSU. I used it a lot in practice. I want to say nearly every dairy calf, and most of my beef producers gave it to their calves at birth or within a few days afterwards. We can provide immediate protection from respiratory pathogens right away, and it lasts for 90 days. There is no maternal antibody interference by placing that vaccine in the nose. That maternal antibodies will not interfere. There's some other molecules that come with that vaccine, like interferon, that really affect viruses that want to attach to the nose, and they prevent that. So it's a really, really good vaccine. If you read the label on that vaccine, it actually says it prevents infection. And about 99% of the other vaccines out there don't match that data. So it's really, really important to use and recognize the power of that vaccine. I've stopped a lot of respiratory outbreaks in their tracks with intranasal vaccines like Enforce. There's some other really good products out there. One's PMH intranasal for bacterial pneumonia. I've used that in herds that have struggled with early bacterial pneumonia as well. It's pretty effective. If you have problems in week-old calves with E. coli, an oral first defense bolus is really, really effective in counteracting E. coli infections in those early babies. I really strongly recommend that if you struggle with those E. coli cases. I think that's all I have.
Okay, Justin, a couple questions that come to mind. You earlier talked about colostrum and sources for supplementation. You talked about maybe a neighbor dairy herd. What's your thoughts about, I guess, the question that comes up is biosecurity, bringing it in from an outside herd versus, say, a real heavy milking cow in your own herd. Using that, I know a dairy cow is going to have bigger volume, but if you got a good milking beef cow, would that be the safer bet? That
would absolutely be the safer bet in terms of biosecurity. Beef cow colostrum is usually about 10 times as concentrated as, let's say, a Holstein cow. So it's super concentrated, so you really don't need as much volume as you'd say that you get from a Holstein dairy cow. Typically, if you're feeding, like, let's say, a 100-pound Holstein calf, we're going to recommend a gallon of Holstein colostrum. For a beef calf, a quart would probably match what that is, because beef cow colostrum is just so much more concentrated. If you're going to get colostrum from a dairy producer, a lot of them are pasteurizing their own colostrum, and that's probably the best stuff, because it's going to eliminate any possible bugs that they may deliver to your herd from their cows. So I'd really recommend it. If they didn't pasteurize it, then maybe look for another source. But if it's pasteurized dairy cow colostrum, I would jump at the chance to use that.
I think you also were hitting on, the dehydration issue about keeping fluids in that calf that's stressed. Say a normal 70 to 90 pound calf, what's adequate volume per day?
Of this supplementation?
Yeah, whether it's a replacer or you're nursing the cow out and tubing the calf. I mean, what would you say is a normal daily consumption of fluids for that newborn calf?
So those calves, if you watch them out in the pasture, they're going to nurse anywhere from 9 to 20 times in a day. So I would think at least a gallon and a half to 2 gallons of milk, let's say for a 100-pound beef calf, a gallon and a half and 2 gallons of whole milk is really going to, or replacer is really going to help them in terms of volume, a milk replacer. And then if they have diarrhea, then we're probably going to supplement with even more with oral electrolytes mixed with water at separate times during the day. But that's kind of the volume I'm shooting for.
I know we learn a lot through research and science over the years, and I think about some of the management practices we've implemented in our herd. I don't think everybody appreciates the impact of colostrum, what it does to negate the efficacy of a lot of vaccines. I mean, it's pretty powerful. Mother Nature had a lot of things right, and so I think like you said, the Enforce and things like that. I guess the one question I would ask, what's your opinion on passive immunity acquired through scour vaccines to the pregnant female?
Those are really, really good. I really recommend that if you have issues with coronavirus or E. coli type scours, there's a couple good products out there, Scour Boss and Guardian, that work really well. We use them on our dairies. We actually don't use them on our beef herds because we haven't had that issue. But if we had problems with those types of scours, those absolutely transmit very well from the cow's colostrum into the calf. So if you gave that cow, let's say 4 to 6 weeks from calving, a booster of that scour vaccine, it really, really helps knock down those scours in the first couple weeks of life.
Okay, we did have a question come in. I'll try to read that for you. What's your thoughts about giving a calf that was stressed during birth caffeine, like coffee or an energy drink?
Yeah, there are some people that have done that to perk a calf up. I'd be careful about giving too much, but I've heard some old farmer tales and some grizzled old veterinarians that put a lot of calves that have seemed to perk up animals with that. Half a pot of coffee is not unheard of, but I wouldn't push it too far, because if you give them too much caffeine, you can actually make them toxic. That is an option, I think, in an emergency scenario. Sure.
Since we're talking about old tales, I distinctly remember relatives in my family talking about eggs, Cairo syrup, and maybe some Jack Daniels.
So the interesting thing you say about Cairo syrup is that if you have a calf and let's say that's got diarrhea and needs some energy, don't reach for the table sugar on your kitchen counter, because that's sucrose and that's not available to the calf. They can't digest it. It'll run right out their back end. Cairo syrup that you mentioned is probably the best thing, because that's dextrose. They convert that to energy pretty quickly once you tube that into them, or if they drink it in solution. So that's a good point to bring up.
No opinion on the whiskey?
I think you should save the whiskey for a producer.
Very good. Very good. What about time frame to get the sodium bicarb to an acidotic calf?
Usually right away. If I pull them out and they've had a tough calving and they're pretty weak and not acting normal, I'm going to give it right away, 1 to 2 cc's per pound, straight intravenous injection, and it works really well. It's pretty remarkable, and especially if you got a calf with diarrhea too that has that metabolic acidosis I mentioned. A calf that can be flat out, let's say it's a week old, has diarrhea, won't get up, you can walk up to it and give it a big dose of sodium bicarbonate, either mixed in fluids or straight off the needle. And within 20, 30 minutes, they're walking around bawling and want to eat. It's a pretty amazing transition you can do by giving that IV dose of bicarbonate. And you can work with your veterinarian, those producers out there that are curious, work with your vet to develop a protocol for that. And it's cheap. A bottle of 100 cc bottle of bicarbonate is like $5 or $6.
I'm not sure if this is a question or a comment. Best timing for scours vaccines is a minimum 8 weeks prior to calving, because it starts forming 6 weeks prior to calving.
Yeah, there's a range. Yeah, there's a range. So 4 to 6 weeks is pretty good. You can reach out further to 8, but I tend to err closer to calving is what I tend to do.
Another question, while newborn processing, is it beneficial to use one-time probiotic supplement like Probios?
I don't really see a lot of data out there that supports that. There's a lot of equivocal data on whether those probiotics actually help. I don't think they actually hurt. I'm not going to tell anyone not to use those. There really isn't a lot of data in cattle that say they're beneficial. The only data that I know in terms of probiotics helping gut health are in humans that have been supplemented with probiotics for weeks on end every day, which probably isn't going to happen on a beef operation if we're going to do that in a practical sense. So, but if producers want to give that, I think that's fine. Those probiotics are kind of just equivocal as whether they help or not.
One last question as we wrap up. A producer asked about the use of products such as Multimin. I don't know if they're referring to the cow or the calf, but your thoughts on Multimin.
I don't have any experience using it in calves. I've used it to booster some of our cows, but I'm a little bit skeptical as to the actual need. There's a lot of different minerals that are in Multimin, a lot more than just that's in a shot of Bosi, which is the selenium and vitamin E. So I really don't recommend probably giving that to the calf unless we have a known deficiency that we're worried about. Cows, I would work, if you're going to supplement your cows, I'd work with your veterinarian to develop a program with using multimin if you think you have a deficiency. But for calves, I would probably shy away from using that.
My understanding was it's more for an acute problem. The half-life isn't real long, I don't think. So, it's kind of a quick fix thing. I don't know if it's a long-term strategy option.
No, we need to achieve those things through nutrition. Yeah.
As we wrap up this portion of the 2019 Ohio Beef Cattle School, I want to thank Dr. Kieffer for all his great information that he provided tonight through the program. But I also want to encourage those viewing this to check out the OSU Extension Beef Team's website, and that's located at beef.osu.edu. A wealth of information there. Many of you are familiar with our weekly publication that Stan Smith puts out, the Ohio Beef Cattle Letter. Also at this website, we have a wealth of information on beef quality assurance. We have a listing of upcoming events and programs. Also an excellent beef resource library with a wealth of information on a variety of topics. And this video, plus many others, are located at our YouTube channel. And also we have a listing of the extension professionals that are part of the OSU Extension Beef Team. So again, check out beef.osu.edu.